Okay, so thank you for joining the Wayne County Health Catalyst for COVID Care Health Literacy Training. We're going to do introductions in just a minute, but before we get started, we'll move on to the second slide. Okay, and this is where I'm going to pause. If you're joining us online, you can click on this QR code or scan it. If you're in the room, Trevon and Rosalinda, Maya's put the link to the pre-session evaluation in the chat box. Chat box? Yeah, in the chat box. It's like, wait, what is that thing called? So if you're able to, I'm going to pause the recording. Ready? Okay. So again, welcome to the health literacy training session. My name's Dr. Carolyn Custer. I'm the project director of the health literacy training portion of the grant. So I developed some of this material in partnership, of course, with our group. And I'll turn it over to Maya.
Thank you. My name is Maya Thompson. I'm with MISHWA and their member services specialist, and I am a certified health education specialist, or CHES. I explain it kind of very similar to the CHW certification, but focusing more on assessing needs, implementing and planning programs, and evaluation and research of programs. So kind of more on the development of programs for community health workers to use right on the ground.
Very cool. Thanks, Maya. Okay, so our agenda for today, we'll do an overview of health literacy. We'll talk about some ways to improve health literacy in our patients as well as in our organizations. Take a short break, and then we'll come back and talk specifically about vaccine hesitancy for a few. Of course, we want your input, so please feel free to either come off mute and share, or if you'd like to use the chat box, you can just go ahead and do that, and Maya will pay attention to that for us. Some learning objectives, describing health literacy as a social determinant or a social driver of health, and then talking about, of course, improving health literacy through class and through some other strategies that we'll talk about. And then again, understanding the causes and strategies for mitigating vaccine hesitancy. So this grant has been in play for a couple of years now. So this is related to COVID, but we will give you some strategies for any interaction with your patients, but also any vaccination as well. All right, so this is a pretty common image. Do you recognize this image? Jarita's saying yes. Okay. So this is, so we're going to start with health equity. Okay. We can't talk about health literacy until we talk about health equity. So what does it mean? And this is just an image showing a visualization of the difference between equality and equity. So you can see equality, everyone's treated the same. Equity, everyone's treated fair and impartial to get the outcome. So it's all about what is our desired outcome of health, right? So health equity is very similar. Everyone has a fair and just opportunity to be healthy, to have health. Now this slide takes it one step further. So it's the same picture, but then on the right, you can see justice. And so the concept of justice is like kind of what we're talking about, all the social justice work that we do, right? And you can see in the third picture, the cause of the inequity, the structural issue was removed. And so all three people can participate. We remove the inequity. We don't need to have accommodations for everyone, right? So that's our goal. So this is just another visual. I kind of like it, the giving tree. So, you know, inequality versus equality. But then, of course, the question is it really equal, right? So then we talk about equity, and then my little. And then justice, so removing the inequity in the first place. All right, so social determinants of health. I'm sure you've probably heard of this, but just as a quick overview, social determinants or drivers are the things that account for health outcomes that aren't related to like the clinical care that we provide in the office, right? So we can do clinical care in the office, but that's really only 20% of what creates you a healthy person. It's the other 80% that really makes a difference in how much health and how healthy we are. And so these are the things that impact health. They're related to where we work, play, live, right? Do we have a healthy place to walk? Are there dogs, right? Stray dogs impeding our ability to exercise outside? Do we have access to nutritious food? Are there grocery stores in the area that have fresh produce? There's a lot of different things you can see here, and health literacy kind of falls into the education as well as the healthcare system piece. So really understanding where we can come in and make some adjustments to make it easier on people and reduce these social determinants. All right, so health disparities, this is a definition, but they're preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health. Like we just talked about with social determinants, they do exist because of health inequities, factors like social determinants, and we have to acknowledge systems designed with structural racism. So health disparities is thinking about different populations, like what's the prevalence of diabetes, right? Is there a difference in race, black, white, etc., in your diabetes control rates, right? So these are the things that we are thinking about when we look at health disparities. Okay. So health literacy in Wayne County, does anyone know what redlining is? You want to come off mute or put in the chat box or pass? Okay. So if you've heard of redlining, but if you haven't, in 1939, the government decided that they were going to put this red line here. You can see the outline. And it impacted where people could live and what kind of resources they had access to. And so what ended up happening was, outside of, so the home loans, it had to do with getting mortgages, right, in the suburbs and whatnot. And so traditionally, African Americans were not able to access these. Oh, I apologize. My husband's eye appointment reminder just came in. I was like, wait, what? I'm not going to go to SVS right now. But access to education and access to healthcare, depending on your color, you couldn't go to certain hospitals. You didn't even have access to some of the things, right? So this is almost 100 years ago, but it still to this day impacts a lot of the quality of life in the populations that we serve. So we have to acknowledge white supremacy in what we're doing at all times. Right. I'll turn it over to Maya.
Thank you. So as we're going to be talking about strategies to overcome health literacy, we want to kind of see where you guys are at with what health literacy means to you. So if you want to come off mute or drop in the chat box of what your definition or understanding of health literacy is. I'll give you guys a few minutes because I know it takes a minute to type out.
All right, so any ideas? Oh,
Great. We can move on while they're typing if you want to.
Okay. Sorry. I'm trying. Okay.
So the first portion is usually what people understand it as right now. It's personal health literacy, and that's the degree to which individuals have the ability to find, understand, and use information and services to inform their health-related decisions and actions for themselves, family members, or anybody else. And then Dr. C is going to talk about Healthy People 2030 and organizational health literacy.
Thanks, Maya. So Healthy People is a kind of a guideline for the health of the nation, if you haven't heard of it. It comes out every 10 years. And in 2010 and 2020, one of the goals was to improve individual health literacy or personal health literacy. But then in 2030, we added something, and this is exciting for me. We added organizational health literacy. So it's not just about our patients being able to access information or to understand. It's our job as a healthcare provider to improve the health literacy of our organization, and allow people to equitably find and understand and use information. So we'll go into health literacy.
So there's a few different components to health literacy, and the first of those are the skills and knowledge needed to interpret health information. The first part of that is going to be literacy. So your reading, writing, basic math, speech, and comprehension skills. And then there's the numeracy aspect of that, which is understanding how math is used in the real world and how you're able to apply it to make decisions. And then the next component is different factors that impact health literacy. So complexity of health information, the language that the person speaks, their age, their status of health, whether or not they have any anxiety or illnesses, their cultural background, which we'll touch on quite a bit, and then the way that the health information is communicated by health providers, which is what we're going to be mainly talking about today. This is kind of the same thing. So they talk about the individual factors that impact health literacy and then those system factors that will also feed into it. A couple of the impacts of limited health literacy in people would be they're less likely to use preventative health services such as pap smears, mammograms, colonoscopies, and vaccines. They're also less likely to effectively manage their chronic diseases such as high blood pressure, diabetes, asthma. They don't have as great poor medication adherence, and they have higher rates of hospitalizations or use of emergency services, possibly a higher mortality rate, and then they report a sense of shame about their health literacy. And then it's also associated with higher healthcare costs. For a limited community health literacy, the impacts might be missed opportunity for services such as free vaccines and preventative screenings, a lack of preparation for different emergencies, so severe weather or evacuations, different missed warnings about environmental health and safety, so contaminated water, and then misunderstandings about public health warnings about food safety, so recalls and that type of thing. So when we're looking at developing health information and health flyers, stuff like that, currently the average reading level of adults is an 8th to 9th grade reading level, but then the most health education materials developed are at a 10th grade level or higher. So when we're developing these materials, we want to make it the most inclusive that we can. So keeping it at that 5th, 6th grade reading level is going to be ideal. When you're trying to figure out if somebody has low literacy or not, these are some of the red flags that you want to look for. So frequently missed appointments, incomplete registration forms, not complying with their medication, they're not able to name their medication, they're not able to give a health history or a coherent history. They don't ask as many questions, which is a huge one. And then there's not as much of a follow through on different tests or referrals that might be given to them.
Okay, so thanks, Maya, for sharing that intro for health literacy. So we're going to talk about using a universal precautions approach. So bloodborne pathogens. You probably have all had training in bloodborne pathogens, being that you work at an FQHC. But the universal precautions approach is very similar. So remember, if you see blood on the floor, you're not able to tell if it has HIV or hepatitis, so what do? We use universal precautions. If there's a fluid spill, we use gloves, right? Or whatever protection we need. So very similarly, you cannot tell what a person's level of health literacy is just by looking at them, even their job, education level. It may not correlate, they may not have a high health literacy. So what do? We use this universal precautions approach, and that forces us to communicate with everyone in a way that people can understand. So we change how we present information. And the goals of using this approach are to simplify that communication, confirm understanding, making the healthcare system easier to navigate, and supporting patients' efforts to improve their health. So there's a lot of benefit to taking a look at how you're communicating and how you're interacting with your clients, and in what ways you might, improve that. Just an FYI, this universal precautions approach comes from the AHRQ, the Agency for Healthcare Quality and Research, and We're going to send out slides, and at the end of the slide, there is references to all of these. So I would definitely look at that toolkit. All right, so this is a busy slide that shows, ultimately, what does a health literate organization look like? We're talking about organizational health literacy. And you can see really health literacy is baked into all the different pieces of the org. It starts at the top with leadership, and it goes down to throughout all of the different departments. Using materials that are easy to understand and getting feedback on those materials are really important in preparing the health workforce, right? Like we're doing right now. So I'm not going to go through each one separately, but these are just some of the things to think about. And Western Wayne is amazing, I would say. All right, so would anyone
Would
like to,
any,
oh, go ahead,
go
Maya.
ahead.
I wasn't sure if
No,
you
you're
were
fine.
on mute.
Would anyone like to share a time when having low health literacy has either impacted you, a loved one, or a client or patient's ability to be healthy?
Anyone have a instance? Oh, Jarita, if you're okay.
Okay. I am currently going through this with my father. He's 84 years old and set in his ways, and he's in a rehab right now. But when the doctors come in, he just responds yes to everything, but he doesn't understand. So he feels like he has to say yes in order to get the services that he needs.
Mhm.
So I'm currently going through this right now, and it is a challenge. And so every time I talk to him, he'll once they leave the room, he'll be like, I didn't quite understand what they said. And I was like, why didn't you say that while they were here? So I end up breaking it down and explaining it to him. Fortunately for me, I am in the medical arena so that I'm able to break it down, like you said, pretty much to a fifth or sixth grade level. He's very intelligent, but far as health literacy, that portion of that medical terminology, he doesn't understand it. And the providers, they do not take time to find out if they really understand. I sat there and I watched the doctor, and they're like, "Oh, you look pretty good, Mr. Austin." But at the same time, they didn't stop and explain what was looking good, what was, you know what I'm saying? Just a little more detail, a little more time would have been beneficial.
Absolutely.
Yep. And that's all I have to share right now. But that was one of that's one right now that I'm going through that impacts the loved one.
Absolutely. And you brought up you brought up something that we talk a lot about and we think about is that answer. First of all, asking, do you understand? Like, we can't ask yes or no questions. Those just aren't going to help, right? Because if you don't know the medical stuff, you might feel a sense of shame and you're not going to ask questions. You're just going to say yes, right? So it's so important for us to also, right, be reading the room and being able to understand, is this working or is this going over someone's head? That kind of thing.
Exactly.
Mhm. Thank you for sharing, Jarita.
Thank you.
All right, and yeah, Rosalinda, you wrote that's true. They're not explaining. That's why we're here doing this work, right? Okay.
We're going to review some different health literacy interventions that are going to help overcome a few of those things as an organization. So these are evidence-based interventions and strategies that you can use to increase different personal and health literacy levels, and they can be used to create a more health literate environment. And Trayvon put in the chat, doctor speaking at a rapid pace and not slowing down for the patient to understand, which is a perfect lead into our next slide, actually. So our first health literacy strategy is clear communication. So making sure that, we've all had an experience with a provider, like we've talked about, where you don't feel understood. You feel like they talk too quickly, that they're just kind of rushing through you. So making sure that we're communicating clear. So greeting clients warmly, making eye contact if it's appropriate, listening carefully, using plain non-medical language, and with that, using the client's words. The more you use their words, the more they're going to be able to understand it. slowing down, limiting and repeating content to only make it the most important, being specific and concrete, showing different graphics, demonstrating how it's done, inviting the client's participation, and then encouraging questions. So when we're communicating about health, whether this be creating content or just communicating in general, you're going to want to consider these 7 different things. So the first one is going to be trust. Will people trust the information? What type of information may be necessary and how do people find it? Is it enough or is it too much? How relevant is it to the people that we're trying to reach? Will it motivate them to actually accomplish this? What are the conditions that surround and affect the audience, so those different social determinants in their environment? What is people's ability to act on the information and what barriers are there? What will the audience think about the information? And then how will different people respond? And so what can we do to keep them engaged and give them support?
Thanks, Maya. All right, so certainly all of those things are important when you think about communicating plain language. We've talked about this just a second ago, right? The one that I always bring up is diet. If you say to someone, what's your diet? They might think, like Atkins or Weight Watchers or whatever, and you're actually just saying like, what do you eat, right? So just say, what do you eat during the day? But really trying to avoid any of the words on the left, and then, using words that are more user-friendly. Right. Your COVID test is positive. So this was an instance, we did a health fair, we were screening for COVID. And someone was positive. I don't remember the circumstances, but we told them they were positive, and they thought it was a good thing because positive is good, right? Positive. Yeah, we want to be positive. And we had explained, no, that actually means that you have COVID. So we switched what we were writing on the little slip. We just wrote, you have COVID or you do not have COVID. And that's fine. We avoided the word that was causing confusion. So just keeping in mind, again, certain words may just not, compute. So you have to be careful and read the room. Okay, this is where I always. So clear communication is, essential. It's like the number one thing you can do, right? The second thing that we're going to go through is using effective health education materials. So, we have flyers, right? We can give patients flyers all day long. Sometimes they end up in the trash. Sometimes they're actually used, but we want you to know the pieces that will make them the most effective and easiest to understand. So like we said before, materials are easy to read and understand. Check for a 5th to 6th grade readability level. There is a way to check readability. If you go on Word in the references, I'm not exactly sure how to do it, but it is there. The purpose of the material is clear. There's no irrelevant information. Like Maya was just saying, information overload is real. We want to make sure that that flyer is not going to overload and turn people off. Of course, using plain language. Breaking up material into chunks, all words on a page is going to turn everyone off, even myself. An action item, to be effective, it could call for an action item, use visual aids effectively, and be aware of confusing numbers. Statistics can be confusing, so I try to avoid them. So with these in mind, what we're going to do is have you take a look at some published health education materials and let us know what you think. You can put some feedback in the chat or come off mute like we talked about. So the first set of flyers, and these are all COVID related. So these are 3 flyers that were released regarding children and vaccination. This happened to be like year 2.5 when we had the booster, the Omicron booster available. So if you look at these 3, there's no wrong answer here. Which one would work for you, and which one do you think would work for your population that you serve?
I actually have to agree. None of them appear to be. Well, let me just go back to what you said. The population that we serve right now, I think the first 2 for us, especially with the in the pediatrics area. The parents are looking for something, of course, children friendly. And the bears and children are attracted to animation.
Mhm.
So that would work better in the peds portion. I mean, even in the front lobby to attract that. But I think far as high school goes, of course, the first one
And
would
you,
be. Mhm,
so you can see there's like bright colors, right?
exactly.
The message is pretty clear. Keep the school year fun going, keep up to date.
Yep. You only have a few words, one or what, two sentences basically.
Mhm. Versus this one,
Yeah.
it's just tiny words, right? That tiny word thing is hard. Trevon or Rosalinda, if you have any feedback, please feel free to chat, put it in the chat. Um, and
Is
so,
it just the three of us on here?
yeah,
Myself, Trevon, and oh, okay. I
yeah,
thought so. That's why I was like, okay, we have to speak up.
small group today, small group.
Okay, good.
I
Um,
would say for the population, definitely the first one, but I feel like also for people, I feel like for the community that we serve, they're not too interested in getting vaccines. So that third one, I mean, does provide enough information as to why you should get the vaccine. So that's what I like about that third one. But of course, you know, the first two make it a little bit more easier for the people to get attracted to the image, I guess.
right. Very good. Okay. So you can see kind of some differences, you know, in approach. We're going to go through a few now that the MDHHS released that we want to point out some clear messaging kind of issues. So again, we want to have clear messaging. If you put extra in, it's not going to be clear. Anytime you have multiple asterisks with multiple fine prints, you're not creating a clear message. So I just wanted to show you how, okay, the booster's available, you know, it targets the Omicron, but this part, right? It's just like, it's too much. So this might work for us, right? As healthcare providers, we understand, but for general public, that's what I'm going to say. This next one is an example of messaging. So again, you have these two asterisks, you have small print under here. And this one, for whatever reason, this caused a lot of confusion, especially like day 6, what do I do? So, you know, I had a girlfriend that called and she said, my daughter's has COVID. She's day 6. She's still febrile. You know, she still has a fever and cough, but her work wants her to come back with a mask. And I said, no, she can't come back until she can't go back with a fever, right? So it was like just everyone thought, okay, day 6 with a mask, but no, they left out this, you can leave if your symptoms have improved or you have no symptoms, right? So this was kind of confusing as well. All right, so what do you think about this? This is a very early flyer that MDHHS put out. So we have these big points, kind of, and then we have like kind of small print, and then we have some little pictures. Any opinion on this one?
Trayvon dropped in the chat. I still wouldn't feel inclined to read them, even though I would understand information overload is definitely in work. Absolutely.
Yeah. So for this one, just as an example, what do you think if we got rid of all the, maybe leave the website, right, for more information, but got rid of the small stuff and just kind of made 4 big points? Make a plan to vaccinate, keep a supply of tests, keep your masks, you know, and learn about therapeutics. That's kind of confusing as well. Oh, Jarita, if you're talking, you're muted. Oh,
They also kind of just look like, I mean, they could be their own flyers,
right.
like
Yeah.
each one.
Yep, that's another good point. You could make a flyer out of each point. All right.
Oh, I'm okay. I was just saying, bear with me 1 minute. I have to move locations, but keep going and you'll just see me walking.
No problem. Thank you. Okay, Maya, I'm gonna turn it over to you.
So what do you guys think about this messaging? What are some things that you see about effective messaging or things that might not be as effective?
It's probably the best example we've seen so far.
That's a good thing. This is actually the Wayne County Health Catalyst grant. They created this for the messaging associated with this grant, right, Dr. Z? Is
Right.
that
Yeah.
correct? Yeah. So as you see, it has, very simple messaging, but it also has a couple different avenues of gathering more information. So something that's really important to remember is that some people might not have access to the web. So being able to have another avenue where they might be able to go and get more information is really helpful as well.
Okay.
So some additional tips while using health materials are don't assume your patient can read the materials. And when reviewing a handout, making sure you're circling or highlighting the most important points. You may be able to personalize it by adding the patient's names and their medications that they're taking, using teachback to confirm the understanding. We're going to talk about teachback in a few slides. And then emphasize the importance of keeping the material so you can refer to it when you're doing a follow-up with the patient. Again, like I mentioned, making sure your patient has internet access when recommending different digital materials. And if they don't, trying to figure out another way to get them more information. And then obtaining patient feedback on materials of whether or not they understand it, what they like about it, what they don't like about it, so you can constantly improve it.
All right. Thanks, Maya. All right, we're going to move on to teach back. Who's learned about teach back formally? Anyone? If not, that's okay. You probably are already doing it. Okay, so studies have shown, that we do not remember. We don't retain a lot when we go to the doctor. And so it's important to use strategies to increase that retention of information and that comprehension. So teach back's a way to check understanding, really, of patients or their family members, to explain back in their own words what they're going to do next. So what are next steps? It's not a quiz. We're not trying to make people feel bad. We want to make sure that you explain that it's really on you as the provider to make sure that you're using clear communication. So why is it important? It improves patient understanding, of course, adherence, decreased callbacks and canceled appointments, and improved patient satisfaction and outcomes. So just like clear communication, teach back uses the same, everything that we're going to talk about today is based off this empathy, the idea of open-mindedness and empathy, using that caring voice, displaying the body language that's appropriate, or the eye contact, plain language, using those printed materials that we talked about. And this is where we'll start talking about using non-shaming open-ended questions. Open-ended questions are much more effective than yes, no, because like we said, sometimes that guilt and shame, it's always going to be just yes or no, I don't have any questions, right? And make sure you emphasize that the responsibility is on you. So this is just a very basic, chunk and teach information. So if the patient has multiple health conditions that you need to review with them, you're going to teach them diabetes, and then you're going to teach them COPD or whatever their follow-up is, rather than trying to go through the entire thing, like all at once. So you chunk it up, you teach it, and then you ask them to teach it back. And that's it. You can allow your patients to, use the materials that will help put it even more in their mind. If they're not able to teach back, then you just reteach using different words and you try again. Sometimes drawing a picture is helpful to increase comprehension. All right, so we're gonna do some role modeling now. This is my favorite part. But teach back around COVID. So Jarita, this is going to be like the experience that you described with your dad's providers in the room. So the first version we're going to do, and I'm going to be the doctor, and Maya is the patient, is the non-health literate, non-teach back. Okay? Please bear with us. Ms. Thompson, you have COVID. I'm prescribing Paxlovid, the antiviral medication authorized by the FDA to prevent severe COVID symptoms in people at higher risk. Paxlovid has 2 antiviral medications in it, 300 milligrams of nirmatrelvir and 100 milligrams of ritonavir. They exert antiviral efficacy by inhibiting a necessary protease in the viral replication procedure. You'll need to take each dose twice daily for 5 days. You also need to use barrier protection when having intercourse for the remainder of your oral contraceptive pack. Serious side effects include allergic reaction. You may see angioedema of your mouth or tongue, skin rash, hives, blistering or peeling skin, or trouble swallowing or breathing. Also liver damage, so look out for hepatomegaly, jaundice, and pruritus. Okay, I'll see you back here in 2 weeks. Do you have any questions? What did I even say? Okay. Go ahead, Jarita. You have a
I
comment?
was just laughing. I was like, you would have lost me at Paxlovid at the very beginning.
I can't even say the words, right?
That's how our patients are. You lose them on that first sentence.
Can be, right? Okay, so
Not see me
now,
in 2 weeks.
oh, I'll see you in 2 weeks. Is that what you said? Yeah.
You would not see me in 2 weeks.
Oh, that's true. That's true. Okay, so let's pretend instead that I'm going to use TeachBack. And I'm the doc. I'm an amazing doc that uses TeachBack. Although community health workers, like I say all the time, are the glue that holds the team together. You're the one that really communicates well with the patient and serves as that intermediary. So kudos. So we're going to do this role play. Imagine this is the handout. Actually, this is the handout from the handout the FDA put out for Paxlovid. So we're going to do another version, and this time we're going to use a handout and some different verbiage. All right. So Mrs. Thompson, as you know, your COPD and diabetes put you at higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral medication called Paxlovid. This is what a dose of Paxlovid looks like. There's 2 pink pills and 1 white pill in each packet. You have to take the whole packet 2 times a day, once in the morning and once in the evening for 5 days. Oops. All right, here's some additional information about Paxlovid. I've highlighted the most important instructions, such as taking the pills whole. And here's a list of medications that you cannot take while you're on Paxlovid. Do you take any of these medications currently?
Yeah.
Okay, great. One thing I did see, your Paxlovid can cause your birth control pills not to work right. So if you're having sex for the rest of this pack, please make sure you use a condom or another barrier method to prevent pregnancy. Here are some side effects to look out for. The most important thing is liver problems. Please call us if your skin or eyes turn yellow or you get really itchy skin or some pain in your abdomen. I've circled the most common side effects. If any of these happen, they should be mild and last 3 to 4 days. All right, so I want to make sure I've explained everything to you clearly. Can you please tell me, how are you going to take Paxlovid and what are you going to look for?
Okay, so each pill packet has 3 pills, and I need to take 1 packet 2 times a day for 5 days and avoid these other medications. I can't remember what side effects to look out for.
The big thing is liver problems.
That's right. I'll call if I notice if my skin or eyes are turning yellow or my skin gets really itchy and my urine gets dark. Will do, doctor.
Okay, so it's a very basic, she got it. She forgot the side effects to look out for, so I just kind of reminded her. But in this example, you can see we're using visual aids and I'm using plain language. Any comments or any thoughts about TeachBack in the example? Okay. All right, so let's move on. Oh, to the non-fourth, say this. So health literacy strategy number 4, small steps to health. This was actually a project that I got to do with the residents at Authority Health. It's not necessarily one of the 5 evidence-based interventions that we talk about for the grant, but it is something very important that I wanted to put in. So we actually did a project where we were doing health literacy work in a laundromat at 7 Mile and Van Dyke. It was so cool. We were there every weekend, you know, we bring props, whatever. We were trying different ways to see, you know, what was the best way to have our docs present information. And it was pretty cool, but the pandemic kind of put a quash on it. So we switched gears and we came up with this project. And Authority helped us have a school-based health center in Garden Park. And so that's how this neighborhood got selected. But really, Small Steps to Health is just small step behavior change, right? When you're working with your clients, whether it's talking about a vaccination or a healthy way of eating or a new activity, you know, increased activity, it's always recommended that you set smaller goals, right? We talk about SMART goals all the time, specific goals. I'll give you an example. You know, primary care docs, we like to prescribe exercise. What is the recommendation from the Heart Association? It's 150 minutes of cardio or whatever exercise a week, okay? So I'm going to come into the room and I'm going to say, okay, Mr. X, I need you to do 150 minutes of exercise a week. How is he going to do it, right? What does that even, water is another one, like just increase water in your diet. It's like, well, if you're not already someone who's drinking water, you may not even, you know, it might not seem natural to drink more water. So in those cases, it's like, well, work with your person in front of you to give personalized, person-centered care and figure out what small goal they can achieve. So rather than saying 150 minutes of exercise a week, you know, what can you do? Can you put on a YouTube video and dance in your kitchen while you're making dinner? You know, or can your grandkids and you do like a whatever, a video, you know, together? You know, or maybe you can't, maybe the person can't walk, you know, can you do chair aerobics? Just trying to think of ways, small goals, something that can be attained. Water, another thing. Can you have a glass of water after your morning coffee? You know, just start with one small step and that can create a habit. And I always share, we had a community health worker in the past who was on a weight loss journey. And so every day during Law and Order, her favorite show, she would walk in place, just march in place for that show. She watched it every single day. And, you know, it didn't feel like much at the time, but that small step led to, you know, over 100 pounds of weight loss. It all has to start somewhere. People get stuck. A lot of people get, you know, depression. There's a lot of stuff going on. We have to be that person to kind of motivate and help create that small step that's feasible for our patients. Does that make sense? Yeah. Okay. All right. So that was Small Steps to Health. I'm going to turn it over to Maya. Actually, Maya, before, well, that's fine. I got to stop sharing and reshare, but I can do that in the videos. All right.
So the fifth strategy is considering language and culture of your population that you're working with. As most of you guys know, Wayne County has a mix of different populations with different languages spoken and cultural beliefs. So we're going to review class, which class is a framework to deliver health care services, so culturally and linguistically appropriate services. It's meant to be respectful and responsive to patients' cultural health beliefs, preferences, and communication needs. And it's used to promote health equity and reduce those disparities. So strategies to implement this, there's a couple different. So the first one is language related. So making sure we're assessing language preferences and different assistance needs. Using acceptable language assistance and do not use unacceptable, which we'll touch on in the next slide. Plan for interpretive services in advance, and then provide written material in the patient's preferred languages. Then we have the culture related, so respectfully asking patients about their health beliefs and customs, avoiding stereotyping based on their religious and cultural backgrounds, and acknowledging and addressing implicit bias. So language translation services, these can be a little bit tricky, but typically this is what we're wanting to do. So using bilingual clinicians and staff members whose proficiency has been confirmed, staff who are trained as interpreters, on-site trained medical interpreters, and then telephone or video medical interpreter services. We want to stay away from clinicians and staffs who are not trained or certified as medical interpreters. And then the patient's family and friend also poses a privacy problem. We also don't know exactly if they know what we're saying to be able to translate that to the best of their ability. So, but if the client insists, we want to respect their choice, but still try to have a qualified interpreter present. And then minors also should never be used just for legality issues. And this is an amazing resource developed by the University of Michigan. They have a ton of different written materials that are translated into several different languages. So this is just a brief overview of what they have. But they've got hundreds of different diseases and conditions, different tests and procedures of health materials that are all translated into native languages. And then this is just an example of that poster that we looked at earlier that was developed by the Wayne County Health Catalyst grant, and it's translated into all of these different languages.
Okay, cultural competency. Okay, so we know that religion, culture, beliefs, customs can influence how people understand health, how they take care of health, and how they make decisions. So it's important for us to provide culturally competent care. Just like we've talked about, it relies on the principles of trust, diversity, equity, fairness, social justice. And it's really a set of attitudes and behaviors and policies that allow us to work effectively. So how can culture impact health engagement? So these are some things to think about when you're with the person that's sitting in front of you. Health beliefs. So in some cultures, people believe that talking about a poor health outcome will cause it to occur. So you may see women who don't want to discuss mammogram because mammogram is associated with breast cancer, even though it's not. Like we don't, it is. It could be. So we need to keep that in mind. Health customs. Some cultures, family members, may play a large role in the decision making. Ethnic customs, roles of men and women in society may determine who makes decisions. Religious faith and some spiritual beliefs may affect how people accept certain treatments. Dietary customs, this is my big one. We always want to, push the DASH diet or whatever we're pushing, but are the people that we're talking to that culturally, are those familiar foods or not? Drives me nuts when will go out and say, okay, go buy all this food and cook this way, but it doesn't match, right? What they're used to cooking or what they're used to buying. So you're going to be a turnoff right away. So really thinking about dietary customs. Interpersonal customs, again, we've talked a lot about this. Eye contact, physical touch, can be expected in some cultures and it can be offensive in others. So all of this is just to really get to know your population that you're serving. Implicit bias. So, we all grow up in our families and our towns and we develop what we call our worldview or our beliefs about the way the world is or works. Okay. And sometimes that results in some unconscious or maybe even conscious bias, right? Or stereotypes or whatnot. So it's really important to understand your own beliefs and values and customs, and then become more understanding and respectful of others. We have to know that our life experience is not we're not better, we're just different, right? And we need to learn each other's ways and learn from other cultures. So it's our job to make sure that we don't that we, number one, kind of reflect and think about some of the things that we thought, growing up, what we've learned, and then making sure that, that doesn't impact how we're communicating with the person in front of us. Any questions about this? Okay. Patient-centered, so person-centered awareness. I'm trying to get away from patient. Just remember, race, ethnicity, gender, spirituality, other factors can play an issue. Don't assume. Understanding the community you serve, talking with people, gaining an understanding of their beliefs and backgrounds, developing cultural humility. Do not think your way is best. And then practicing cultural etiquette, just being respectful in others' beliefs and values. And then if you do have some time, again, like I said, the slides will go off. This is a link to the Office of Minority Health has a great a lot of different resources for different cultures and populations in health and how it relates to health and healthcare. Okay, so I'm going to stop. We are going to do a quick video. I do apologize. Okay, so it's just a 3-minute video. We're going to play and then we'll.
Culture. It isn't limited to race and ethnicity. It isn't limited to race and ethnicity, though we often think it is. It is the set of experiences, family traditions, individual heritage, and community membership that is unique to every person. And it's easy to think we know someone based on our assumptions about their culture. But each person is unique. And culture is not a fixed set of defined rules. If we treat it as such, our assumptions can lead us to create obstacles for others that we may not see.
One of my close friends at work identifies as gender non-binary and wants to be referred to with the pronouns they, them, or theirs. Coworkers, however, continue to use pronouns such as she or her. My friend is afraid to say anything about it for fear of being seen as a troublemaker.
Assuming that we know or understand someone based on our generalizations about their culture can be faulty and dangerous. It can lead us to misunderstanding, miscommunication, and mistakes. These assumptions can leave others feeling like outsiders and negatively impact workplace interactions, educational environments, and patient care.
I had a patient from India who was suffering from anemia. I was talking to her about the best way to get iron into her diet with the assumption that she was a vegetarian. After a few minutes, she asked me, couldn't I just eat more red meat? I could have asked a question about her diet instead of making an assumption about her culture, and the question would have helped me provide better care.
Many of the people with whom I've interacted have basically conflated the term race with ethnicity and sex with the term gender. It seems like everyone who isn't a member of a majority group is just lumped under the term minority.
One of my colleagues told me that he was surprised I'm lesbian because I dress like a woman. It's almost as if he would have been more comfortable with me being lesbian if I looked the way lesbians are supposed to look.
I'm of Hispanic origin and was told that the only reason I was hired here was because I speak Spanish, even though that's not a requirement of my job.
One of my supervisors made it clear that he thinks women should be more feminine, and that when they are confident and express their opinions openly, it's off-putting.
When I was trying to decide which graduate studies to pursue, an academic advisor pushed me toward a math specialty, in spite of the fact that I had no desire to pursue studies in math. He indicated that I might be good at numbers because I have an Asian last name.
Cultural sensitivity begins with the understanding that we can't stand in someone else's shoes, and that culture is as varied and multi-layered as each individual. But while we can't live someone else's story, we can approach others with humility and kindness, with the willingness to listen and understand. By checking our assumptions at the door and believing others when they talk about their experiences, we find the humanity that is our common thread.
Okay. We have a few more slides and then we're going to take a 5-minute break. Oh no, okay. So again, empathy and open-mindedness. All right, we're going to switch gears just for a few minutes and talk a little bit about trauma-informed care, just because that's my specialty. Has anyone read The Body Keeps the Score? No, Jarena, okay. If you get a chance to, I would recommend, like chat, no, okay. Oh, Trevon, you have. Was that, oh, that was earlier. Never mind. That's why Maya works the chat and I don't. All right, so has anyone heard of toxic stress? Okay. Adverse childhood experiences. Okay. So, we're going to talk just very, very briefly about stress, because I think it's important to understand this concept when you're going in and talking to your clients. So we understand there's a link, right? There's a link between trauma and toxic stress and how it impacts the body, both physically, mentally, really holistically. So a very, very brief introduction to the 3 types of stress. So we talk about stress, we're talking about that fight or flight feeling that you get, when a bear chases you. No, not necessarily a bear, but that terrible feeling that you get in your stomach here. That fight or flight, that's what we're going to talk about. So positive stress is actually a good thing. If you can imagine, when you feel that fight or flight, all your hormones, right, they get all jumped up. The big one is cortisol. And cortisol, if you take a look at this, you can imagine this is the level of cortisol that goes up. It goes up real quick because you're stressed, you have fight or flight, but it comes right back down to normal. Positive stress is like, taking a test and getting nervous beforehand, or same thing for like playing sports. It's a good thing. It's part of normal development. And then we have tolerable stress, which again, imagine the cortisol in your body going way up, and then it comes back down to normal, but it takes some time. Okay. Tolerable stress can be buffered. So this is when we're, you're in a car with your family and you see a really bad car accident. Maybe there's a dead person right on the ground. As a child, that's very stressful, but you have your parents in the car and they're buffering that, right? So they're saying, you're okay, we're here safe, that type of thing. So it's stressful, but it can be buffered. Toxic stress is the one that we're talking about. And in this case, the cortisol goes up, but it doesn't come back down to normal. And so high elevated cortisol over time, it can do that damage. It can cause inflammatory changes to your immune system, all of that type of stuff. So, we talk about adverse childhood experiences, things like sexual abuse in childhood or domestic violence in the household, things where there's stress and it's chronically elevated. Even things for adults, like going to war, for example, that's where this comes in. And so you can have those health outcomes, those poorer health outcomes because of this. So how does that impact what we're doing? We have to be mindful of the environment we create. That's the biggest thing. A lot of people we treat already have mistrust in the healthcare system, and rightfully so. So we have to think about, what kind of environment. The next slide shows Maslow's hierarchy of needs. If you're familiar with this, that's great. If not, really, we talk a lot about, we want you to get the vaccine for COVID, right? We're talking about COVID vaccine to someone and they're thinking about, well, I don't have a place to sleep tonight, or my kids don't have food tonight. At the end of the day, we're not going to get anywhere on these higher levels until our basic needs are met. And we have to have these addressed first. And that's just the big thing, right? It's great to talk about even mental health, right? We want you to get better, go to counseling. But if you don't have the basic needs, you're not going to have time or, the wherewithal to schedule those appointments out and do all that. So we have to just really basic needs have to be cognizant of all times. All right, last slide, and then we'll take a quick break. Again, thinking about trauma-informed care, trauma-informed space, understanding that toxic stress can impact health. It's important to create an environment where the people you're with feel comfortable. And this is some of the questions that I do with this lecture with graduate students. And really, these can go with, you can substitute culture or language. Are you considering the culture, right, of the person? Are you using respectful and culturally appropriate words? Thinking about bias. Do you have any bias that you need to consider? So just really creating a space where the person you're with feels safe, that they can share if you don't have that, then you're not going to get anywhere with your patient. Any thoughts on trauma-informed care or space? Okay. We're actually doing pretty good. We just have one main strategy left to go through. So we'll go ahead and take a 5-minute break. Let's all get up, walk around, and we'll start again at 10:12. Okay. Zoom. Okay, so now we'll move on to some strategy. Oh, this is Maya, not me. I'm sorry, Maya.
You're okay. So we're going to be moving on to some specific strategies used to decrease vaccine hesitancy, and then we'll go into a little bit more COVID specific as well. So vaccine hesitancy is defined by the World Health Organization as a delay in acceptance or refusal of vaccines despite different availability of those services. And it's one of the top threats to global health because there's few effective strategies that address this problem. A couple of the causes of vaccine hesitancy are healthcare and socioeconomic inequalities and inequities, a lack of effective public health messaging, unethical research involving ethnic minority groups, as well as structural racism, social disadvantages, lower levels of education, and access to high quality and accurate information, and then the growing spread of misinformation, disinformation, and conspiracy theories. Barriers to access, including vaccine delivery time, location, cost related to socioeconomic inequalities and marginalizations. So a couple of the CDC recommended strategies are motivational interviewing, which we're going to go over, and then combating misinformation.
All right. And this guide came out with 12 strategies. They're all good. They're good for vaccine in general. I would definitely take a look at this guide. All right, so motivational interviewing. Has anyone learned about it, motivational interviewing before? A little? Yeah. So yes, please go ahead and do more research and investigation after this lecture on every single one of these topics. MI is a huge advantage to, it's a style that is amazing, but you have to learn it, right? So, okay, so let's talk about MI. MI is a guiding style of communication. It's really active listening, balancing good listening with giving advice. It is designed to increase the patient motivation. So remember, we talked about small steps to health and what motivates people to change, right? A little bit. MI is just a way of talking and asking questions that can bring those things out and allow people to hear themselves say those things. So let's move on. All right, so this is the spirit of motivational interviewing. This chart just basically shows, here's the MI, and here's the traditional approach. So traditionally, we have more of a paternalistic or authoritative, meaning the healthcare provider, which was always a doctor, right, knows best. We're the experts and you don't know, so we're going to tell you what to do. That's basically how it's been in medicine. Motivational interviewing is different. It's a partnership with the patient. You're making decisions together based off the information that they provide when you're talking to them. So it's asking questions, it's getting to know, it's being curious, right, about how people think and feel about things. And using a method like that where you can honor their decision, right? It's a joint decision, but it's really them. We might be the expert at how to treat a disease, but the patient's the expert at their body, their family, they know, they know their situation, they know what's going on. So we have to partner. We can't just assume. One of the models for MI is ORS. This is a pretty common one. It starts with open-ended question for O. So like we've talked about, if you say, do you understand? You're going to get yes. Do you have any questions? No, right? We want to avoid yes, no type questions. We want to start with open-ended. So, explain to me or tell me more about how you feel about how your diabetes management is going or whatever, right? So just an open-ended question to start with. And then you listen and you are sincerely listening. So, affirmations is the next step. And this is just showing that you acknowledge like what they're telling you, right? So one of the things that I use this phrase a lot is it takes a lot of strength to go through what you've gone through. You know, just something like that can be affirming and let the person know that you've heard them, right? Reflections in a similar way, reflecting back what the patient says shows that you're listening as well. So reflections are good, you know, every couple information, you know, every few times that you ask a question, you might want to put a reflection in and say, from what I'm hearing, it sounds like, or, you know, let me make sure I understand you clearly. What I think you said is this, but really just reflecting and then summarizing. So you've had a conversation about a vaccine, about COVID. You know, you kind of assess where they're at, what are their motivations. And then at the end, you summarize, you say, okay, this is what I heard, you know, and then they can hear back and they can say, no, I didn't mean to say that way, you know, so you can clarify any kind of ambiguous stuff. So really using this method, practicing this method, it's really important to practice quite a bit. Like I said before, this is not a one and done type thing you can learn, but I encourage you to do that. Specifically about vaccines, again, don't start with the assumption that the person accepts the vaccine. Start with a very soft start. You know, how do you feel? Acknowledge the patient concerns without judging. Judging will put you in a bad spot. Do not judge. Have empathy. Really, if the patient is providing, well, we'll talk about information in just a minute. Let me go back. All right, avoid criticizing. This is exactly where I was going. You know, people might have heard the information from their parents or from the elder at the church, or, you know, it could be anyone, and you don't want to judge. You don't want to say, oh, well, that's not true. Instead of doing that, providing high quality information from a positive frame is more effective. We'll talk about that a little bit more. Showing awareness as a status as a messenger. Community health workers, you are messengers. You are, like I said, the glue. It connects the community with the medical facility and the services that are provided. And then linking the vaccine acceptance to the patient's hopes and goals can help motivate them. One example with COVID was, you know, the elderly, the senior citizens who they couldn't see their grandkid. Remember, everyone was stopped from seeing their kids, so they had to, you know, communicate through the doors and everything. But you know, if someone said, I really want to see my grandkids again, you know, you could say, well, the vaccine is a way that you get to see your grandkids again. So you can link it to something that they've stated. We're going to do a We're going to do a motivational interviewing example. And Maya's going to be the patient and I'll be the healthcare provider. And so in this role play, we're going to do both versions, of course. The first one's going to be the traditional approach that I just talked about with doctor knows best, we're the expert, the patient knows nothing. Okay. All right. I walk in the room. It's important, Ms. Thompson, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still cases of measles in the US? This disease could be very dangerous. And what about meningitis? It could be fatal, you know. You should update your child's vaccinations as he's already late according to schedule. We can do that now if you'd like.
I don't see the urgency, and autism is worse than measles. There are more problems than solutions with this vaccine. I think it's completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated there's no link between autism and measles vaccine. The vaccine is safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines at the same time is safe and not associated with more pain. We should do that now.
I've heard something else and not only on the internet. I've read a lot and vaccination is not mandatory. I can do what I want.
Well, yeah, you're right. It's not mandatory, but you're putting him and other children who cannot receive vaccines in danger. The risk of disease are much higher than the risk of the vaccine. If I'm taking the time to speak to you about this, obviously it's really important.
It's easy for you, quick, but what if he gets autism? I'm worried about the risk of vaccines, but you don't seem to be worried about the health of my child.
Of course I am, and I'm worried about the fact he can get diseases that can be prevented by vaccines.
I don't think we understand each other. Let's talk about this one another time.
Okay, so, you know, I'm telling her she has to do this for her child, and she's becoming opposed, right? Not the outcome we want to see. Because we want the kids to be up to date. All right, we're going to do another version of the same scenario, but in this time, we're going to use motivational interviewing. Okay, hello, Mrs. Thompson. What do you think about the advantages of vaccination?
Well, I know that vaccines protect children against several diseases that we don't see anymore. My child received all of his first vaccines, but I'm worried about the measles vaccine and that it could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
Okay, as you said, vaccines have reduced diseases in such an important way, they are now much less frequent. It's why you have vaccinated your child when he was a baby. If I understood you correctly, with the exception of measles, other vaccines seem safe to you?
Yes, I know it's a good thing to prevent those infections, but about measles, I'm conflicted. You know, I've read a lot of books and articles. Lots of people are worried about the link between the measles vaccine and autism.
Okay, so you find it important to protect your child against diseases when the vaccines are safe, but you're worried about what you've heard regarding autism and measles. I see you've done a lot of research about the subject. If you agree, I can give you some additional information on the studies with autism and measles.
Sure, I want to know exactly what happened.
In fact, you're right. One study had hypothesized a link between measles vaccine and autism, but this study was fake and the author lost his medical license. More than 500 additional studies around the world have demonstrated there's no link between the vaccine and autism. The frequency of autism is the same in a group of vaccinated children as in a non-vaccinated children. So what do you think?
So I'm not crazy to be worried about that?
No, of course not. You're totally right.
Thank you for taking the time to understand my concerns. I think it's a bit clearer now.
Okay, so, this technique allowed the mom in a non-judgmental way to express her concerns, and then I gave her some solicited information that she wanted to hear because we weren't just telling her what she had to do. All right. All right. Let's move on to this, which is pretty quick. So misinformation, disinformation. Does anyone know the difference between the two? All right, so misinformation is false information that's shared, but the person sharing it doesn't realize that it's not true, right? Disinformation is when people purposefully share untrue information, false information. And we have a lot of both, and we'll talk about that. So social media, this is just social media, right? These are all the different places people can get information. And this is just to show that no wonder there's a lot of confusion. There's a lot of different sources, right? So some of the ways to combat mis and disinformation. We've already kind of talked about this, don't judge, right? Providing factual, easy to understand information is the best way. Using credible sources, to demonstrate your facts. You may run into the problem of people not believing credible sources are credible anymore. That's a whole different lecture, but just making sure that you use CDC, NDHHS, those credible sources, trusted messengers. We saw over the pandemic commercials, right, with local celebrities or the docs at the hospital or some of the pastors in the community. Those are all trusted messengers, just like you. So you guys, like I said, you guys communicate, you are the bridge between. As far as information goes, we used to have a whole segment on the COVID vaccine, which it's not relevant anymore, but we do want to review the COVID vaccines just briefly. So everyone remembers in the beginning, there was that primary series that it was the monovalent, mono meaning one, so it covered that original strain. And then they came out, remember, with the booster. So that was the bivalent, and it was bi meaning two. It covered the original strain, the Delta, and the Omicron variants, BA4 and BA5, which were responsible for that big spike that year. Those were the past. We're not using either of those anymore. So this is the most important thing. We have 2 current COVID vaccines. We're not calling them boosters anymore. We're just yearly vaccine, just like the flu, your annual COVID shot, your annual flu shot. They are formulated to protect against the current subvariants. I'm not going to tell you which, the BB.1.5 or whatever. And it is recommended that everyone get one dose. So some of the subgroups have different schedules, but basically it's one. And I do have booster in there, which I will take out. So this is Moderna and this is Pfizer. Any questions on the vaccine specifically? So here is a summary of what it takes to get vaccinated, right? So if you're a patient, how do you get vaccinated? First, you have to learn, right, about it. You have to have intent, you have to prepare. So, you know, prepare for any type of appointment, make sure you have childcare, transportation, all that stuff. There's costs involved, maybe not so much here where we have a lot of insurance coverage, but if you're not covered, right? And then, you know, how many times you have to come back in and then afterwards. So if you look through this cycle, you can see all these different systems and all the different factors that go into a decision to get vaccinated, right? So we have to think about all these different pieces because they impact our patients. All right, so our last interactive.
Yeah, if you guys have any situations where someone refused to get vaccinated due to mis or disinformation, and then if you wanted to share how you reacted, was it effective? And then, so consider a time when a patient refused to get vaccinated or a loved one, anything along those lines.
Does anyone have a time that someone didn't want to get the vaccine?
Myself, I mean, I got all my vaccines, but my sister, she also received all her vaccines as a child. And when COVID had first came out, you know, she already had my my niece and my nephew. And so I don't know what, you know, website or who she was talking to about, you know, getting vaccines and stuff like that. But just like how a lot of people say, oh, it could cause autism, my sister didn't want to get the kids vaccinated when, you know, COVID first came out. And I think they're still not vaccinated, if I'm not mistaken. But it, you know, with COVID just coming out and everybody, you know, it was like death rates were going up and stuff like that. I was scared. So I was telling her, like, girl, I'll even pay you to get the kids vaccinated, you know? But she all had just this information that supposedly there's ingredients in there that cause autism and all this stuff. And I was like, well, you know, where's your facts from, you know? But she really couldn't even tell me, but she was just so persistent on not getting the kids vaccinated though.
Thank you for sharing. We've heard that story, I think, every time. That's a very, very common family member with an issue. You know, I even had a fellow colleague who's now retired, but I saw him at Costco and he was like, did you get the vaccine? And I was like, yeah, I work in public health. And he's like, the government's going to track you with the chip. I'm like, okay. So, you know, we've heard it, we hear it. It will continue. I think it's pretty common when vaccines come out, you know, hesitating because you want to see how it, you know, pans out and plays out. I know personally, I've shared that when HPV came out, I waited a little bit for my kids to get it because I wasn't sure, even though I was sure. So we have to consider all that. It's complicated. All right. Any other thoughts, comments? We're about done with the session. Anything else that you thought of or this stimulates?
So we're gonna just kind of summarize a little bit of what we discussed today. So, in our key takeaways. So the first point is low health literacy is associated with lower health knowledge, poor medication adherence, increased use of emergency resources for primary care, and increased mortality rates. All of these impact the quality of life and all are impacts of low health literacy. It's important to use the universal precautions approach and assume all patients have a low health literacy level. And then improving individual and community health literacy levels can reduce vaccine hesitancy and increase COVID-19 vaccination rates. So again, the recommended grade level for written health education materials is that 5th to 6th grade level to keep it the most inclusive that we can. Health literacy strategies can be used to increase patients' understanding about their own health conditions and empower them to take a more active role in their health. And so those strategies are that clear communication, our teach back method, the class, so using culturally and linguistically appropriate materials, motivational interviewing, and then combating mis and disinformation.
Okay, so we are at the end. We do have a post session, so we'll put this slide up in just a moment. There is an additional training through the CDC if you're interested. It's provides some more information on health literacy. And then the resources for today's lecture. So what I'll do is I will email you all the slides as well as this one pager. There's like a handout that we made for the grant on the different methods that you can use to improve health literacy. If you have time and you want to do the post session, you can scan the QR code or you can use the link in the chat. If you do the post, you'll see there's a way to get a certificate from Wayne County Community College. You have to fill out the whole evaluation, as well as at the end, it'll ask you for things like your name, date of birth, etc. That's because Wayne County registers you as a student in their continuing education department to release the certificate saying that you attended today's session. So if you're interested, please go ahead and take care of that.
I do want to mention, Drita,